Grady Health System opened a mobile emergency unit to prepare for an expected surge in flu cases. Now, this is the second year in a row that the Atlanta hospital has used a portable ER to help with the overcrowding. The Fox Medical Team's Beth Galvin shows us how it works.
The goal is to speed up wait times and ease overcrowding in the emergency department, and the unit is expected to help Grady handle about 100 additional patients a day, most of them with flu-like illness. And this year, Grady's opening up this unit a couple of weeks earlier than it did last year, hoping to get out ahead of the flu.
Much like other emergency departments in the city, we're very busy. We have a lot of patients who are coming to the emergency department who are in need of medical care.
So for the second year in a row, Grady Health System is opening this mobile ER just outside the ambulance entrance of one of the busiest emergency departments in the Southeast. Dr. Hanny Atala is Chief of Emergency Medicine for Grady Health System.
We're already seeing an increase in flu. We've had over about 170 cases through our emergency department alone. Some of those patients go home. Some of them have been admitted to the ICU and everything in between.
On loan from a Charlotte hospital, Atrium Health Carolinas Med 1 can handle 12 patients at a time and can be set up and ready to go in as little as 48 hours. The trailer will give Grady more space because the emergency department is expecting a surge in flu cases in late January through February. Last flu season, the ED was treating as many as 500 patients a day, about 100 to 150 more than usual.
It helped significantly. We were able to get through about 100 patients a day through here, and that allowed us to sort of decompress our waiting area. Ideally, and this happened last year, we want our waiting room empty at all times.
And starting Thursday morning, patients with flu or flu-like illness will check in through the main emergency department and then be escorted by a staff member to the mobile unit. And Dr. Atala says the patient reviews have been largely positive.
Most of them really like it. They think it's interesting, just like everyone else does. And I think for our patients, as long as the care is there, which we're confident it always is, they're happy to be seen anywhere in our department. For us, it's really about making sure the care is there.
And this unit is on loan to Grady for about $200,000 a month. Dr. Atala says Grady plans to keep the mobile ER open as long as they need it. The CDC says since October 1st, about 6 to 7 million Americans have been sick with the flu, and about 84,000 or up to 84,000 have been hospitalized. So the flu is here, and we're feeling it across Georgia. For the Fox Medical Team, I'm Beth Galvin.